I'm Dan Freed. I'm a radiation oncologist at the Gibbs Cancer Center and Research Institute. We started doing SpaceOAR back in August of 2015. At that time it was very new. I did a little reading on it. It in theory sounded really like a great idea, and so we decided to bring it here and try it on some of our patients to see if we could find improvement in the dosimetry of our plans, and then ultimately if we were going to have improved outcomes for them. It's gone great. We've been very impressed, really right from the start. We were impressed with our ability then to separate the prostate from the rectum and to have a really quite dramatic decrease in the dose that we were delivering, especially the high dose radiation to the anterior rectal wall. So first of all, I'll start by saying that I think the CyberKnife is a fantastic tool. We use it all the time for our low and favorable intermediate risk prostate cancer patients, and they do great with it. Our problem is not a problem with the CyberKnife. Our problem is a problem with anatomy. And it's just a simple fact that the anatomy is not favorable to do radiation for prostate cancer. And the biggest reason for that is that the anterior rectal wall is just a millimeter or two behind the prostate. And when we treat with radiation, we always use a margin around the prostate to make sure we've accounted for motion or setup error, microscopic extension of disease, and other things. So in building in that margin, you're building it directly into the anterior rectal wall. So SpaceOAR allows us to create, now instead of a millimeter or two, we have 1.5 centimeters of space between the structures. It allows us to do the plan that we want, put in the margin that we need posteriorly, and really decrease the dose of radiation that's received by the rectum. We have a process in place that allows us to do the whole thing fairly efficiently. From our schedulers who help. We have a packet of information that is developed for each patient. It has all of their appointment times and prescriptions and descriptions of the procedure and other things in it. And so that now is quite automated. It takes only a few minutes of the time for our schedulers and our nurses to prepare a packet like that. Those are sent out to our patients. It has everything they need in it, plus a number to call if they have any questions, but most of them actually don't have any questions because the packet itself is quite complete. From there, we try to stack them up to schedule multiple patients in a day when we're in the operating room. Typically I'm in the operating room once a week for a morning, and during that morning we place 5 SpaceOARs along for most of these patients with fiducial markers as well.